and we will be having another guest coming in shortly. But this morning we have Nick Davis.
Nate.
Why do I always want to call this man Nick? Thank you. I'm so sorry.
Nate Davis with us.
Yeah, thank you, Barima. He's
Bermina. What's going on with you today?
I don't know, Barmina. I'm sorry. Founder of Cruise Care LLC, licensed Medicare broker. Born and raised in Dorchester, Massachusetts, Nate Davis has committed his life and career to serving the very community that shaped him. As a proud black entrepreneur, Nate is the founder and owner of Cruise Care LLC, a non-emergency medical transportation NEMT company dedicated to assisting underserved community members, particularly seniors and individuals with disabilities, who face challenges assessing essential care and services. So, good morning, Nate. How are you?
Good morning. I'm good. How's everybody?
Good.
We're live and alive.
That's what I'm talking about.
Yes. We're happy to have you on the show this morning.
I appreciate you guys having me.
And so we're going to talk a little bit about what you do. And if anybody want to call in, our number 617-282-0685 or 617-282-7794. Again, People Power with Priscilla. We are the people and we have the power. Okay, so tell us a little bit about how you got into Cruise Care LLC. So give us a little background.
So some background on that. So I've been in the insurance space for some years now. I last was working with a primary care office. And they're a different type of primary care office. What they do is it has a value-based medicine model. Mm-hmm. And basically everyone in the clinic is some type of partner to the patients that come in. It's a geriatric clinic, so they only service seniors 65 and older. Mm-hmm. So they have, of course, your primary care provider. They have what's called a GGP, which is a gathered guide partner, someone like a social worker. So they'll help navigate like different applications, or like if they have any food disparities, filling out like SNAP food benefits, or different resources to like different food pantries and things of that nature. They have MTPs, which is medical technician partners. Mm-hmm. And they're all EMTs by trade, so they can do in-home appointments, they can do vitals in the home, come out to do physical assessments, things of that nature. So they're like the doctor in the home, mm-hmm. while, they'll remote a primary care provider on the screen to be able to talk, because of course the providers can't go out because they got multiple clients. And then there was myself, which was a PBP, which is patient benefits partner, and my job was to help the patients navigate their benefits. Mm-hmm. So mainly in insurance, like if you get a bill, I'll be able to tell you, if you owe some money, if you don't owe some money. I've worked both the payer side and the provider. I worked for United, Senior Whole Health, Tufts Health Plan. So I've seen it all when it comes to insurance. I was last an appeals analyst, so we get the last final say. When you get those denials, whether it's for medication, surgeries, and things of that nature, we all may sit at the table and consult, looking at medical necessity guidelines on, okay, does this meet the guideline? If it doesn't, should we make an exception, if it's a unique circumstance, things of that nature. So working for Gather Health, one of the good things about them is they provide transportation to and from. Mm-hmm.
For their patients.
For their patients, okay. Yes. And if they refer you out to any specialist, they will also provide the transportation to them. Because working with that company, I realize there's a lot of people that haven't seen doctors in ages. I'm talking about 7 to 10 years.
Wow.
There is a shortage in primary care providers, so a lot of times when you try to call, they're either not accepting patients, mm-hmm. or the appointment's way down yonder. You're like,
right.
How am I gonna do this? And one of the good things is, with them, they get a list of all their patients who either gets discharged from the hospital, who went in the hospital, but their clinical model is to try to keep you out of the hospital. But, mm-hmm. I've seen them save some lives. There's a lot of AFib patients that come in and about to have a heart attack, so they'll get them to the hospital and save some lives. So I've seen that happen. And it's so the way they get incentivized is to keep you healthy and out the hospital, opposed to like the bigger industries who's fee for service where they bill. And so I kind of resonated with that model, because I'm like, hey, I just lost my dad a couple years ago, and I'm like, yeah, thank you. He wasn't getting the care that he needed, and now my grandmother's coming up. I want to make sure she's good. I end up having her join the clinic. So one of the disparities that I seen, or the disconnect, was trying to find transportation for these folks with wheelchairs. And I'm like, it would be hours, like we're trying to call somebody. There's times I had to pull my truck up and pick a patient up and put him in the car and throw the wheelchair in the back and get him home because we couldn't find nobody.
Wow.
So I'm like, wow, it'd be a good business. We all want to think about the money, but we want to think about the people too at the same time. So that's what caused me to go and open up the company, to be able to help those folks who don't have the means to be able to find a ride and things of that nature. So that's how I started my company with that.
Could you go into a little bit more detail? Because I'm not sure that everyone knows what an NEMT service is. So could you go into a little more detail about specifically what that entails? And then what is it that your specific company or your nonprofit provides, the services that you provide?
Absolutely. So non-emergency transportation is basically, I'm not an ambulance.
Right.
I'm not EMS. This is simple patients that may need a ride to the store. They may need a ride to their appointment, or wherever it is. Some of them go to cookouts or whatever the case, or family member's house. Right. So we're that person that can go up, pick them up. Even sometimes some of my guys had to carry them in the van because they have stairs and they don't have any ramps. So we provide that service. All of them are first aid certified, AED certified. They have to do a training for dealing with those type of folks, because you got to have those guardrails in place, because it is an expensive industry to be into. You got to have all the insurance, and just in case anything happens, because we're dealing with fragile people, so we want to make sure we take care of them. So I haven't started the nonprofit yet. That's coming up next. Okay. There are some times where I offer some services for some folks, so I guess that helps. Sometimes it's not all about the money. It's because you can help, and it's like, I offer my services if I can. We try to have the insurances pay though. That's the main thing. That's where the money's at. My thing is, folks worked all their life for these benefits, so we want to try to utilize them.
Exactly.
Which is another reason I hopped into. I'm a licensed Medicare broker. Okay. So that's what I do.
Tell us what that means.
Yeah. Go into detail on that.
Yeah. So I got my business and I operate that under that with the agency. So basically, I navigate all benefits. So a lot of folks don't know that just being on Medicare, you may also qualify for Medicaid. So we look to see, one, if there's a Medicare Advantage plan. So you have your Part A and B. Your A is like your hospitalist, inpatient stays, and then your B is like your outpatient, like your primary care and different specialists that you see outside the hospital.
Oh, and can you just differentiate the difference between Medicare and Medicaid? Yep.
So Medicare is through the government. It's through the U.S. It's what everybody pays into. You've been paying into it since you had a job. And then Medicaid is the state benefit. So it's the Mass Health with us in Massachusetts. And so basically, Medicare pays for the first 80% of all your medical. Okay. And then you have your 20%. A lot of people just have the Medicare and they think, oh, I'm good, but I just got a bill. What happened? I got insurance. Well, no, you're subject to the 20%. So we try to get you on what's called a Medicare Advantage, which is your Part C. There's also a Part D, which is prescription drug coverage. So folks don't know, if you're not on a prescription drug plan, you will be penalized by the state.
Really?
So you want to make sure you have a PDP at the minimum, because there's some folks, when you're on a Part C, you're subject to that company's network, depending on if you're on an HMO or PPO. PPO is like you got in-network and out-of-network benefits, but the HMO, you're strictly tied to that network. So some people don't like to be tied to a network, which we get it. You want to go anywhere. You got those folks that travel around the world. They may want to see a specialist down in Florida because that's where their vacation home is, and things of that nature. So those type of folks, they'll get on what's called the PDP, the prescription drug plan, so their medications are covered wherever they go. And then the Medicare, they pay that. and sometimes there's supplements. So there's supplements is you pay a monthly premium, to cover the other 20%. Sometimes you may be paying a little bit more. So my job is to sit down with you to see which one is more cost effective according to your diagnoses and the medications and the specialists that you're seeing. So sometimes I run into people who they're not sick at all. They're healthy as a doorknob, but they're paying thousands of dollars for these plans, and it's like,
Really?
you don't need this. A lot of the Part C Medicare Advantage plans are zero cost premiums. So you can go on that plan, still have all the coverage. It comes with dental, vision, hearing, and your prescription drug coverage all under that one plan. But we just have to see which one fits. So my job is to go over all that and see which one is in the best interest of you. Because if you're paying thousands of dollars and you're not sick, you're just wasting money. You're just giving these insurance companies money. Now, if you're somebody who is sick and you have a lot of specialists, you may be a cancer patient, things of that nature, then that might be the plan for you, because you at that point you're saving if you don't have Medicaid. Now, they have what's called with Medicaid, if you're not making more than $2,900, then you should qualify for some type of Medicaid. So each client that I run into, that's the first thing. I want to see if you qualify for Medicaid to help you save some money. The highest level of the Mass Health is the standard, and that's where you would have $0 out of pocket. They help pay for like in-home care, companionship, HHA, which is home health aid, where they can come help you clean the house. If you need some groceries, you can get your life alert, you can get your laundry done, things of that nature. The lowest, which is still good, is what's called the Medicare Savings Program. And what that does is they help pay for your Part B premium. Now, everybody on Medicare has a Part B premium that they have to pay monthly. This year, the cost is $185. It went up from last year. Last year was $174.70. So it's probably going to go up next year, but the major thing is to try to get that money back, because we all know when you're on the Social Security, every penny counts. So being on that Medicare Savings Program, they'll help pay for that cost. They'll also pay for like prescription copays. And if you're on the lower tier with the Medicare Savings Program, they may cover your Part A premium and some other copays and co-insurance things.
That's a lot of information.
Yeah.
Absolutely.
I hope y'all writing that down.
And I know probably half our seniors don't know anything about that.
Yeah.
At all.
Yeah.
At all. And I'm the broker, like, so I can meet somebody who's just on Medicare and I can just throw you on a plan and keep it moving. You know, I got paid for the sale. I know you're on a plan, but it's not taking you to the finish line. I want to make sure you got all the benefits that you qualify for. If you need help in the home, if let's say you got a grandchild, or your child is coming in and helping you and you want to get them some type of incentive, they got what's called adult foster care and group adult foster care. Now, the difference is adult foster care is someone that's taking care of you, a family member, friend who lives with you, where you can get a tax-free stipend of about $1,400 to $1,600 from what I've seen, which is monthly, it's tax-free, you know, and that's just for helping your loved one. So we want to maximize on that. Then they have
changed that, right? Because before they didn't want the family members to do it. They wanted outside people to do it, and then that changed, I believe. I think it depends on the program that you're looking at. They have home health aides, where if you're enrolled with a home health aide and you try to have a family do it, it's two different programs. So if you have to go with the company with the home health aide. Now, if you want a family member, you're either gonna go with the AFC, the adult foster care, or the personal care assistant, and that's when they get a certain amount of hours, and it's kind of you kind of got your family member on the payroll, so they have to submit a timesheet, and then they get paid by it's called the ASAP, which is the agency that kind of administers that for the state. Wow.
Yeah, so it's about looking down, seeing. I work with a few different ASAPs. I also work with a home health aid agency as well. Which I want to start that myself as well. So that's coming down the pipeline soon. My vision with Cruise Care LLC is I got the broker aspect, I got the transportation, then it's going to come to AFC and the home health aid. So that's coming down.
Okay.
So it's just one thing at a time. So with the skilled nurse and home health aid, you'll have a skilled nurse that come out, do different. It has to be a registered nurse or above. that comes out and do different assessments to see what you need in the house. It's to help you with daily living activities. So if you need help getting dressed, showering, eating, getting around, that's what that would kind of help you with.
Mm-hmm. And you said you're born and raised in Boston. Being that you're so acquainted with the city, what are some of the things, the health issues, the most prominent health issues that you see facing Boston residents, but more specifically Black Boston residents? And this could be from the perspective of before you got into this industry, and then once your experience within the industry as well.
Absolutely. I think working as a claim analyst and member services, like we see a bunch of claims. I also worked the provider relations where they would send over a bunch of claims to see why we didn't get paid. Definitely heart disease, heart attacks. There's a lot of patients that's AFib and can have a heart attack at any moment if you're not taking your medication, if you're not in the right climate or even the environment that you're living in. Trip and falls, diabetes, that's another big one. Let's see. Just overall not going to the doctor. I see that every day. Like I said, there's people that haven't been they see their provider in 7 to 10 years. I was watching a video the other day, even with the young folks, and it's like, who's your PCP? Where do you go for PCP? And people's like, what's PCP? And then you tell them like your primary care, and they're like, I don't know. And I think that's one of the biggest issues with folks, not going to the doctor, not scheduling those annual wellness visits, preventative, because it's like, yeah, you may not feel any symptoms or any of that, but you got to look at your family history. You got to look at what's hereditary down the genes and stuff that you can catch early. There's stuff that we don't see, we don't feel, but if we're not getting the testing, we'll never know. And then you wait to the last moment, and then you're out the door. So people want to definitely look to see with primary care. We get a lot of people in Gather Health. They do same day, next day appointments with like urgent care. They can pretty much get you in either same week or next week for their care. So that's another good thing with them.
How would someone know about you? How do people know to contact you for different things? Because you said you have a couple of things going on, so I'm just wondering how folks get in touch with you.
So you can get in touch with me. I'm working on a social media page right now. But Nate Davis, phone number 404-207-4188. Nate Davis on Facebook. I'll have
put his phone number on the
line. It's live. It's live. It's under the business. You can Google it. You know, I'm not hiding from nobody. My head's up high. You know, I walk these streets every day, and it's a lot of referrals. I know a lot of people in the community. I've been in the community. A lot of people know my folks. I grew up in St. John Missionary Baptist, so people know me out here. I'm not hiding from nobody. So, like I said, 404-207-4188. Call me directly. If you have any questions, concerns, I'll be there. We'll schedule an appointment, and then we can set something up.
Yeah, because I believe that a lot of people, like you said, haven't been to the doctor, you know, and some, because it may have been so long, they don't even know if the same doctor even is around, you know, because sometimes these doctors move, you know, and leave, go one state, go to another.
Exactly, and that's what it is. The benefits packages with these different hospitals. A lot of them want them to help pay for their school bills, so that's kind of why they switch. But there's also a shortage too, you know. A lot of those old doctors are moving on. There's new medicine, and folks want to get into different things and pay more and run their own business. So, but yeah, so we gotta utilize. Another thing with these providers is they usually have about 3,000 to 4,000 patients under their panel. Wow. The good thing about Gather Health is they're not going over 750. So. They really take the time to manage with their folks. But yeah, people got to see them doctors, set up them appointments.
I think part of the issue is part of the reason why people are averse to the medical system, especially Black and brown folks, because it's mistreated us historically, and it continues to do so. So it's like a lose-lose situation in some areas and some scenarios, because you go to the doctor, they mistreat you, then you end up being in a life or death situation. You don't go, and you're not getting the proper care and treatment that you need, and you're not getting your checkups. I have the same problem in my family where big problems have arisen, medical issues have arose because people have been so adamant about not going to the doctor. I think one of my family members hadn't been for like decades before COVID. So
yeah, that's crazy. One thing I do see is I do see that, but there's been a lot of guardrails put in place. Like I said, those medical necessity guidelines, there's different assessments that have to be done. And if you ever go to the doctor, or you know somebody that's been to the doctor and you feel like they're not getting the good care, you can always call up to the insurance company, because they're the ones essentially paying for this, and you can file a grievance and they'll investigate that. They'll look into it to see what was done and look at the clinical notes, and they'll go back. Like, there's things put in by the state and the feds that are supposed to be guardrails. So if you ever feel like you're not, being heard, or they're not doing something, well, you can go somewhere else, talk to somebody, go somewhere else and really, work with that provider and explain what's going on so they can kind of handle you a little better. But I deal with a lot of, especially seniors that are stubborn and don't want to go. They don't want to get the care. They don't need this, that, and the third, and they need it. One of the things that I see with seniors is they don't want to accept the fact that they're getting old. And I get it. I get it. But a lot of things come with age, and we have to stop being stubborn with ourselves, especially black men, because we know they're the main ones that don't want to go out and get the care. Yeah.
It's them.
So we got to stop being stubborn with ourselves. We got to stop with these woke videos, looking at these AI videos, and just like, I don't want to do this. I heard somebody tell me the other day, I don't want to get a mammogram. Like, what do you mean? You want cancer? Like
yeah.
So we got to stop being stubborn. We got to get out there and watch out for our care, for sure.
Yeah.
So Gather, that's the insurance company?
No, Gather is a primary care office.
Oh, okay.
And then the insurance. So I'm independent. So I'm operating under the Cruise Care, Nate Davis. So Medicare. So that's the insurance. Medicare broker. So the insurance would be, I'm contracted with different companies. So United, Tufts, Molina Senior Whole Health, Fallon, Aetna, Humana. It's a bunch of them. So.
Do you just deal with seniors?
Yeah. I get other people. Like I got a group of folks who I'm connected with. Like a lot of them that's been released from prison and need help, like navigating their benefits and getting on the mass health, finding a PCP. So I help them. I don't get paid to do that. That's just like my charity work that I help. And then there's other folks that be like, hey, I'm dealing with this, that, and the third. I got a bill and this, that. So I'll do stuff like that. But it's mainly who I work with on the day to day is like Medicare, seniors, and people like that, or people on disability. We'll be working with those folks. Because essentially, when you're disabled, you're able to get on Medicare and have the mass health, and they get on what's called a One Care plan. So it's a under 65 plan, which coordinates and administers both the Medicare and the Medicaid for them. So, and like the PACE program. So we'll be doing some more stuff. There's more stuff coming down the pipeline. Just to mention, there's a lot of people worried about the big bill with Trump and what's going to be happening with the Medicaid.
I was just about to ask. I was like, have you noticed? I don't know if it's gone. I don't think it's gone into effect yet. But with the current administration, have you noticed a shift or any difference or an impact to Medicare and Medicaid?
So there's gonna be a slight shift. A lot of people don't know that bill with the Medicaid was based off of the Massachusetts design, so it's not gonna hurt Massachusetts as much because we're like a model state. But one of the big changes that's happening is that folks who qualify for Medicare that are just on the mass health are going to be kicked off because they want you to apply for the Medicare. Medicare has to pay their part, which is trumping them, the feds. So they want them to pay their 80% before they come in and start, paying all the bills when, somebody else should be paying their portion. So if you qualify for Medicare, if you worked your 10 quarters, if you're a citizen, definitely start applying for Medicare, and then we can talk. You can get back on the Medicaid.
At what age do you start applying? When you turn 62?
So it's 64. It's like 6 months before, 3 months before, and 3 months after is your window where you're supposed to apply for it. And then if you're not on a plan or you're not on that prescription drug plan or comprehensive plan, like through a job or something, you will be penalized. So you want to make sure you apply.
Wow.
Yeah.
And what is the penalty look like?
I think it's like 10% of. It's 10% or something. I would have to look that up. But yeah, it depends on how long you've been without it. So they have a certain formula that they look at, but it's like 10% of something. I would have to look
So
it
you
up.
have to be on the medication.
You have to be on like a prescription drug plan because you have to cover your medications.
And
essentially.
they penalize you if you don't. If
Yeah.
you're not.
Absolutely.
I'm sorry, that doesn't make any sense to
Yeah.
me. I mean,
There's a lot of things that don't make no sense. Absolutely.
these penalties here and fees there, you know.
The thing that gets me is they say you make too much once you make over $2,900, or you don't.
$2,900?
Yeah, you don't qualify for
Like
mass health.
$2,900.
$2,900. If you make more than that, then you don't qualify for Medicaid at all.
That's it.
Yeah, you don't qualify.
I mean, what is $2,900 this day and age?
That's
nothing.
not even a month's rent.
I usually run into seniors and I ask them because Mass Health looks at the gross. They don't care what's deducted out.
Yeah, and that's
Yeah.
another thing. I don't understand why people do that.
Wow.
Lenders do that too.
Yeah.
Bankers, they look at your gross.
But that's not
But-
all the money I got.
Exactly.
That's all the
It
money
just-
I wish I had.
It really doesn't make any sense.
Yeah.
You know, I never understood it and never will. Hello.
morning.
Yeah, but
Yeah,
another
but
good
the
thing
one
is,
right coming in.
for certain folks is for the people that need the help and they're over the cost or the income limit. They have what's called the frail elder waiver, and that's when a nurse has to come out to do an assessment to see what daily living activities these folks need help with, and that's a way to get on the Mass Health standard. It does take a little longer to get on it. But it can be done if the person really needs the help. They just have to go through the motions of getting that, working with the right person. So if you feel like you need help with daily activities, definitely tap in. Let us know so we can, kind of help coordinate that.
Thank you. So I see our second guest has arrived.
Hello.
Good morning.
Good
Thank you for having
morning.
me.
Thank you for coming. You want to introduce yourself? Tell us who you are and what you do.
Yes, absolutely. So my name is Abigail Jean-Baptiste. I go by Abby, but Abby or Abigail's fine. And I am an outreach partner at Gather Health. Essentially, my role is to facilitate the gather portion of the name of our company. So I make sure that our elderly population has access to information pertaining to Gather Health, but also access to one another. So yeah, that's basically my role in short.
Okay, so are you in partnership with Nate?
Yeah.
Okay.
So Nate actually is, I don't know, like, did you mention formally? Yeah. So he used to work with Gather. Now he is an independent entity. So he's really, really integral into us, one, getting more access to more people who could use Gather services. But also, like, his expertise on insurance is phenomenal.
Yeah, he's been giving us a lot of information here.
Yeah, I bet.
Just to add into that, Abby mentioned about getting folks together. So when they came up with the Gather company, the value-based medicine is not new to the country, I would say, but it's new to Massachusetts. There's
What kind? With the what?
the
Value-based care.
value-based medicine.
And what's that?
So that's where I told you. So they get incentivized for keeping folks healthy and out the hospital,
Okay.
opposed to the fee-for-service model where you want to have a bunch of people come in so you can bill
Right.
for the profit.
How is that incentivized?
So they go under what's called a risk contract. So just a way I would put it is they get an allowance to manage those folks.
Okay.
And if they don't meet the guidelines and keep them folks happy, then the risk is on them.
I would say too, it's a little deeper than that though, because our providers are literally incentivized to make sure that our patients are treated well. So like, they get their regular salary, but they get an additional bonus for the month by month, year by year progress that the patients make.
Oh wow.
Yeah.
And it's just like, so with the company, it's like, let's say we give you $10 million to handle or manage this amount, like let's say 500 patients or whatever the case is. And it might have only cost you about $6 million. So you just profited, you know, your $4 million for the company to do other things and help build the company and scale it up. But what I was gonna touch on was bringing folks together so they realize that there's a high percentage of seniors that suffer from loneliness and depression. So they're at home, the folks don't come see them, or they don't really get out much to see friends. One of the good things that Gather does is they do different events in the clinic, and then they do bigger events quarterly. So they've had senior proms. I think there's a event coming up in August, like some type of summer event for like carnival style, I believe. We've done like a mixed event with like Thanksgiving and Christmas together, and it's a great event. In Dorchester, they usually do it at the Florian Hall. They come out, free food, drinks, win big prizes, nice DJ dancing, and those folks get down. I don't know what happens the next day to them though, but they come out.
Tell me, do you go into any of the senior housing?
Oh, we go to all the senior housing.
Okay, that's good.
Abby can touch on that a little bit.
Yeah, so the events that he's talking about, those are pretty much reoccurring. But each outreach partner is essentially responsible for hosting their own events. So we get the opportunity to be a little bit creative about how we go about that. So for example, last week, Nate and I did an ice cream social at the Harbor Point Apartments. So we brought a little ice cream. We gave everybody an opportunity to socialize, and then we gave them a little info bit about Gather Health and how we could potentially be of service to them. So we do that. We have tons of events that take place throughout the weeks, and it could be anything from like that kind of a small scale thing. I'm planning a future like morning nature walk for some of our seniors. We have some people who love to do like karaoke, and they make it like a big thing where there's a theme, and it's amazing to see like the amount of people who come out, and also like the opportunities that we get to be creative about giving them social opportunities. So it's really cool.
Great. That sounds really good.
So I know you touched a little bit on Gather Health and the events that you guys have, but could you go more into like just more specifics about who you guys are, what you do, and what does your day-to-day look like, especially within your own position?
Yeah. So Gather's goal ultimately is to provide equity for our elderly population. They oftentimes get overlooked, especially because they need like specific special attention and special care. In our like general healthcare scheme, the average PCP has approximately like 2,500 patients that they're seeing per month. And that's like each individual PCP is seeing that many patients. At Gather, we cap our PCPs out at 750 per month. And the reason we do that is so that they have more of an opportunity to spend more time with their patients. They get more of a psychosocial and physical image of each patient and what they need. And so to even go further on that, like their flexibility and adaptability is really tailored to the patient. So we do in-home visits where we send our like trained EMTs to go in, and it's like a video call with the PCP. So it's as if the PCP is in the home with them, facilitating the visit. And we do same day and next day visits, even for new patients, which is a big deal in Boston, because especially with all of the things going on in the healthcare space right now, it's really hard to get an appointment. So that's another thing. We also provide free transport to and from PCP visits and specialist visits. So let's say, for example, you originally were at BMC, you have your cardiologist at BMC, but you want to switch your PCP together. We will still send you to your cardiologist free of charge. We'll pick you up from your house, send you there, and then bring you home. So really just like keeping in mind the specific needs that our like elderly population is really needing, and that they oftentimes have to advocate for themselves for in a regular healthcare space. So that's sort of more of like what Gather Health does. My role being the outreach partner, doing the quote unquote gathering, I'm getting the word out. So when I host an event, it is absolutely to make sure that people are getting access to one another, but it's also giving them access to us as a resource. Because I mean, not a whole lot of people know that it exists. And for the people who know it exists, they may not even believe that it's real, you know?
Right.
So I answer all of the in-betweens. I oftentimes have Nate with me because he's so knowledgeable, and a lot of the questions people have are about insurance. So we just try to be really perpetual about making sure that we have events in place so that more people can have access to more information from us.
So it's like a 2-in-1. So she not only helps schedule the appointments, but also create these events where it's just, I'm not just going out there to try to get people to sign up. It's, no, we want to bring you guys together, whether you join or not, you know, just to have you guys together and take place in these events to, you know, kind of diminish that loneliness and depression that most folks have. Because some of them just sit at home all day. You'd be surprised. I didn't see folks would be like, oh, I haven't left the house in ages. And it's like, oh, especially now that it's hot out, so it's good to have them folks out. We did that Juneteenth event over in
also
Columbia
Harbor
Point.
Point,
Yeah, that was great.
Oh, we were over there too.
Oh, you was there?
Yeah,
I swear we seen you.
I was gonna say, I feel like I saw you.
Yeah, we were over
Harbor
there
Point,
with
it's
Sister.
Harbor Point.
Yeah, with Sister Patricia and them.
Okay.
Yeah, it was really nice.
Oh, and this was before the Franklin Park one?
Yes, this was
Okay.
it was the day before. It was the 18th of
Okay.
June.
Yes.
Yeah.
That's right.
So that was a good event that we had. And just to touch on, so with Gather, the average appointment is about 40 minutes long. So instead of somebody just coming in and they're asking you a few questions, typing on the computer and not really paying attention, these providers have certain assessments that have to get done to really get to know the patient. During their first appointment, we ask that they bring all their medications so we can see what's going on with them. Check to see if there's any contraindications, like how are you liking these medications. I know when I first brought my grandmother in, she's like, I'm on one of these pills that's making me go to the bathroom over and over, and I'm tired of getting up. And we have the medical director, Dr. Griffin, who's her PCP, not to put her business out there, but who's actually great. He helped her lower some of those medications, get her blood pressure stabilized, and her diabetes stabilized, which she wasn't getting down south. She's from Alabama, so it was good that helped her. She felt better. She felt greater. She's actually down there now, like, hey, I've been better than ever. I can't wait to see Griffin, and I really like that. So that's kind of what grew on me. Where they really take the time to get to know people. They actually do the physical assessment, check for that edema, see if there's any swelling in the feet, look at them toes, feel them legs. So they really actually take the time to look at these seniors and get them the help that they need. So.
And Abby, we asked Nate this, but how did you get into this industry?
Specifically healthcare or like Gather as a company?
Healthcare and then Gather as a company.
Okay, so healthcare. So I went to UMass Boston. I studied exercise health science, and like I've always known that it sounds cliche, but I've always known I wanted to help people. But I think for me specifically, one of the most infuriating things that I witness is inequity. I can't stand to see it, and I feel like when we have specific groups of people who by like age range are kind of being cast out, it feels like very counterproductive, because the idea is, God willing, we all will get there. So I feel like that in itself kind of fueled my studies a little bit, along with like other like inequities as well. So I wanted to do physical therapy. And I worked in a PT clinic for a while, and the physical therapist kind of told me, like, if you're gonna do PT, you wanna, like, you have to lock in. Like, I think, sort of like shortening my story, every medical facility that I entered, it became more about either finances or politics than the actual patients. And I was getting really frustrated with that.
Yeah.
So at one point, I was working for a company called AMI. They're not in Massachusetts anymore because unfortunately with this presidential administration, a lot of really great programs have been closed. But they were helping immigrant populations get on their feet in this country. And so when that ended, I literally just so happened to walk by a Gather Health sign. And I'd always seen it in passing, you know, orange letters. I'm like, this is interesting. What does this even mean, Gather?
Right.
So I looked it up. I read that their mission is to assist elderly populations in making sure that they have psychosocial and physical health and equity. And I applied, I applied and I got the job. So yeah, I'm very blessed to be in this position because it's right along with what I've been wanting to do. You know, like I said, it is difficult, like in this current political climate, to hold on to those kinds of roles. So I'm really, really grateful that this feels like solidified for me. Yeah.
And that just touches, like, just listening to that, that goes back to like the fee for service model where you got these folks who, and I mean, I've worked in the industry. I've worked for a provider's office. I won't say their name, and they are for profit. When I actually went in there, kind of why I had to leave, because I was a little pushy back then, and my focus kind of changed because I was more into the money. I was one of the financial coordinators where before they was a non-profit entity, and then somebody else brought them out and it was a for-profit entity. And it was like you would get a lot of patients who would say, oh, I don't know what this, why we build this, and what's this, how was this process, and I'm not going to pay this. And it was like, no, you got to pay this or we can't see you.
Yes,
and,
that's very common.
But I would have to sit down and explain, the billing, how everything was billed and why it was billed and how it was processed by insurance and what their member cost share was. And then it was like, oh, okay, yeah, I'll pay this. And I made the company a lot of money, but it was more finance for us, and we wasn't really, focused on the medical, and I didn't like that, so I kind of got out that space. But that's a good thing with Gather, where it's more incentivized to keep you healthy and out the hospital, opposed to like most people going to their physical once a year. Well, geriatric, they want to see you every 3 months, and if you're in worse shape, they're looking at you maybe once a month to come in. So
yeah, I think also like that's part of the reason why I was so attracted to Gather, because they're like, we're providing the healthcare that people are supposed to be getting. And like he was saying, a lot of like everything for the most part is based on fee for service. So there's a whole lot of like, for lack of a better phrase, like placing a Band-Aid on a wound that, really needs like some stitches and some nurturing and some care. And it requires time, it requires patience, it requires effort. And in the grand economic scheme of all of it, it's not lucrative to go the more slow and steady route. But Gather is way more focused on the actual people and making sure that they have good quality of life. And that's huge for me personally.
Exactly, because a lot of these facilities, I don't think all they do is think about the money, and that's a problem. It's always money, money, money.
Yes.
But I am so glad to have met both of you all, and the work that you do, because we know a lot of seniors, like especially during COVID, it was really, really rough for our seniors. And we started the Black Boston COVID Coalition, which enabled us to make sure that we had testing. We made sure that we could get vaccines, PPE. We made sure we had food. It kind of like, and we did, we gave out gift cards to our seniors, and we also did wellness checks, to make sure that they were okay, and if they needed something, they could, they could get it. But the medical system, as I have a brother that's waiting for a heart, and he's had a kidney transplant. He's had 2 back surgeries, and the medication that they were giving him for his kidney interfered with the medication they were giving him for his pain.
Oh my
So he's so fluid kept coming, building up on his heart every so often. So he spent a lot of time in the hospital. And finally, I believe in 2001, they gave him an LVAD, which is basically keeping him alive. He's waiting for a heart transplant. And it's been very difficult. I'm not going to name the facility either, but it's just been very difficult. And we see the disparities in the health system when it comes to black and brown people. There's no denying it. I don't care what you say. I mean, not only my brother, but there's other people that, are going through the same thing with their doctors and stuff. I haven't been able to even see my PCP in over a year, I believe. It's always her patient assistant, or
Nurse practitioner.
nurse
and I'm
practitioner,
like,
PA.
well, I might as well go to find another hospital or something, So yeah, it's hard. It's especially, I'm a senior too. It's hard for us, but I work with young folks. Maybe that's why maybe that's why I don't I do stress, but it's just wonderful to hear you all talk about this. And if someone wants to reach out to you, could you give them your information? You already gave us your phone number, but you can give it again. And yeah, because I would, because I do some work with the seniors. I'm trying to create this program called Senior Soldiers, and I've been talking about it for a minute, about 4 or 5 years. And I do it in a sense, but I really don't do it. What it is that I would like to do is for our seniors to be able to go down to City Hall, to hearings, and be there to listen to them. And after the hearings, bring them back to our office for lunch, or have one of the city councils give them lunch, and we can discuss what was being said. Because now, you can watch it on, different TV stations, or, if you have Chromebooks or whatever. But some of our seniors don't have none of that stuff, So, why can't they? And there are some programs now that do, like with Age Strong, they do different things for the seniors. They have events during the week for them, like they have karaoke and painting, and, they take you out to like different like movies and concerts and stuff, so they really interact. So that's why I wanted to do this program where we could have the seniors go down on Wednesday, because every Wednesday is that's mandatory unless they cancel the meeting. And the things that they are discussing affects us, but a lot of times we don't have any say on it because we're not at the table. We don't know what's going on, So yeah, that's we made up a little song, senior soldiers know their right. Senior soldiers know how to fight for human and equal rights. Senior soldiers fight. So,
I like that.
yeah, so yeah, because we're basically trying to pour back into our youth so that they can take over, because we know we're not going to be here forever. And it's the way some of our seniors are treated is just, it's ridiculous. It's harmful, and it hurts. And so I'm glad so if someone were to reach you, needed to contact you, would you give your information again? So if they, because I don't know how much more, let's see how much more time we. 2 minutes. 2 minutes. We got 2 minutes.
Okay. So again, my name is Abigail Jean-Baptiste. And by the way, for those of you listening who have maybe friends or family members who don't speak English, I speak Haitian Creole, French, Spanish. But my phone number is 617-777-6584. You can call me or text me at any time. I usually respond in business hours, which is like 8 to 5. But even if you leave a voicemail or a text message, I'll always get back to you. So yeah, definitely reach out if you're just curious and you just have some questions.
And mine again, 404-207-4188. Also, my email is nate.davis@cruisecarellc.com. If anybody wants to shoot an email, I know some folks don't use it, but you can. And I work all 24 hours, so call me whenever. My line's open.
He's not lying.
So
Yeah.
All right.
And
Well,
where are your facilities located?
Okay. Yeah. So.
yeah, good question.
Yeah, I don't know how much time we have, but so we have 4 locations. I work out of the Dorchester office that is at 301 Columbia Road. The other 3 are Lynn, Brockton, and Quincy. You can look online for the addresses for those, but yeah, all the information that you need would be at gatherhealth.com.
Okay.
Yeah.
Well, I'm gonna definitely check into Gather Health, and I'm definitely gonna talk to you guys.
Absolutely.
I just want to thank everybody for listening. I want to thank Nate and Abigail for coming in, taking their time, and for you all that need this service, don't be shy. We this seems like a wonderful program. This is the only program I ever heard of that want to keep people out of the hospital instead of putting people in the hospital.
Yeah.
So, thank you all.